Vanessa here today, another lovely patient of ours, and she's again kindly decided to open up about her journey with us, which is really, a help for a lot of our patients. So Vanessa, tell us a bit about your story and your weight loss surgery journey.
I got surgery in July 2021. So I'm coming up to 10 months now past surgery. Weight loss surgery was something I wanted to do for a number of years. I have small children and we were tossing up whether or not to extend our family. And then I took the plunge and I got private health insurance, and the countdown of the 12 months began. And in July 2021, my life changed forever. So
congratulations.
Thank you.
It is a big plunge, isn't it? It's a big decision to step into that and to go down that journey. So
it is. It was a big decision, but as I mentioned, I'd thought about it for a number of years, and I have a couple of friends through other friends that have had it done, and seeking their advice on surgeons and things like that was quite good. Because I didn't really know where to look. So it was really nice having, they're not too close to me. So it was nice to reach out and just sort of, suss out private health insurance and how to go about it, because I feel like it can be a bit overwhelming at the start, picking a private health insurance, out-of-pocket costs and things like that.
Yeah, absolutely. It's definitely helpful to have somebody who's already walked in that journey to be able to give you a few pointers of what to look out for certain clinics and that kind of thing.
Yeah.
Now, when you came to us, you actually found us online, didn't you? And you decided to seek support outside your surgical practice. What was it that sort of made you decide to do that?
I think I was 2 weeks post-op, and my surgeon unfortunately didn't have much aftercare in support with food choices and going from liquid stage to soft food and to more solid food, and I felt like I was just thrown in the deep end a bit on my own. And I actually found you guys through Instagram, and I rang up in a bit of a panic thinking I just needed some reassurance and just some help with multivitamin choices. It was very overwhelming at the beginning, and I feel it was a little bit disappointed that I didn't get the aftercare with the surgeon that I picked, but it turned out to be a blessing in disguise, because I have just had an amazing journey with my dietitian, and it's been so much more than a dietitian journey. It's been the reassurance of food choices, realizing that you are on the right path and everything that you're doing is normal, and multivitamins. That was really a big help because there is so many on the market. I was so overwhelmed, and my dietitian provided me with so much information and a couple of different choices as well, to fit with pricing. And there was a couple of like 1 or 2 brands that I tried that didn't really agree with me, so we had another one to pick. And it was really just the friendship and confiding in someone and the reassurance that you really, really need at the start of the journey, I think.
Absolutely.
It's been lovely. It's been really,
great to hear. And like you say, it can feel like a daunting journey, and I'm sure a lot of people find themselves in a similar situation to you, where you research the surgeon, and it's so important to get the right surgeon to do the surgery. Absolutely. And look, some surgical practices have a fantastic support team, which is great, but maybe for some people, either they live in an area where they can't get that, the surgeon that is there doesn't maybe have that support package, or they want to have a particular surgeon but doesn't come with that support package. And so it's just good, I guess, for everyone to know that there are options out there. Even if your surgeon doesn't come with that, you can come to another practice to sort of get that support. And like you say, it's more than just a diet plan, isn't it? It's all the other bits.
So much more.
Yeah,
so much more.
Fantastic. And because like you say, it's you need that reassurance as you go through. We've tried so many things in the past, and we, you know, we really want this one to obviously work. And you need that sort of companionship and that support along the way as well. We hear that from a lot of our clients too. So it sounds like you've made a huge transformation over the last, you know, 10 months, not only in terms of where you are with your, I guess, your weight and your well-being in that way, but also in mindset changes. So tell us a bit more about how your mindset has changed from the beginning of your journey until now.
At the beginning of the journey, and this is where the dietitian really, I think, just played such an important role. Even though I was week 2, I was beating myself up about things that, you know, I was eating or things that I was thinking about food. And it was such a big process to do the surgery. And I just wanted to do it perfect from the beginning. And I just, to have the reassurance, just, it really changed my mindset pretty early on. I remember a time, I think I'd just started solid foods, and I ate mac and cheese for the first time in a very long time, and I beat myself up about that for, I reckon, about 2 weeks. I was like, it was a terrible choice. It was just, and I just was so hard on myself. And in that time I had a dietitian appointment, luckily, and I had all my dietitian appointments actually by phone, and she reassured me that it was just one bad, it wasn't even a bad choice. And that's the thing, is you learn over your journey, is that there's no bad foods. You can, because as long as everything you eat is in moderation, and you can't eat an entire block of chocolate or a whole thing of ice cream anymore because you physically can't. That's just my baby. Oh, sorry. And it's you can enjoy all the foods that you did before. It's just you're eating it in such a smaller like capacity now. And the thing is that it's just one bad day is not going to ruin your entire journey. And sometimes, you know, all of us, we all have bad days with food, and, you know, it could be, you know, something going on in life that's that you've just that day you've just had enough, and you know, haven't chosen probably the best choices, but that's not going to ruin everything, and you don't need to beat yourself up about it. And to get to this, like at this point now, I realize that I eat to live. I don't live to eat anymore. And that was such a huge change for me, that my life doesn't revolve around food anymore. And it just has opened so many doors. It's just, I just wake up feeling so much happier and healthier. And it's not really just about the scales or the weight that I've lost. It's literally how I feel every morning when I wake up. I just feel better. And it's just been such an amazing journey, and I feel very lucky.
Fantastic. And it's interesting to hear, as you say, we often think that when we have surgery, automatically we're going to feel that way, right?
Yes.
And because of course we want to. We're going through this to change, to feel better about ourselves, to change our relationship with food. But as you say, it doesn't happen overnight. And particularly in those early days, you're really wanting to get everything perfect. But it sounds like through that and through some of those sort of challenging times, you've sort of learnt a lot about yourself and about what's going to serve you and what doesn't serve you in terms of I guess the mentality around eating and good or bad, or being perfect or not perfect, that kind of thing. So
exactly.
Good on you for learning about that. And so, as you say, you dietitian to help with that. Any other tips on how people out there can help with that mindset transformation? Any other resources that you've used before, or?
It's really just simple things. Just trying so hard not to compare yourself to other people. And I know, you know, we go through our entire life trying to tell ourselves this, but everybody's journey through weight loss surgery is so different, you know, and your journey may be going a little bit slower, or it may even be going faster than other people's. And it's just, you've really got to try not to compare yourself. This is your journey. This is your time. And, you know, the first 12 months is all about you and learning all different food choices, all different mindsets, and you just take it slow and try and enjoy it. And I know that's so much easier to say, but I wish that sometimes I could go back to, you know, 2 weeks post-op Vanessa and just have it, you know, just, it's going to be okay. You've got to stop being so hard on yourself. Because I feel like, well, I know for me personally, I was very hard on myself within probably the first month because it was so daunting and I felt alone. And then, yeah, it's just, you've just got to try it. Just take it easy and don't be so hard on yourself.
Absolutely.
And
yeah. And like you say, seek support, whether it's through a clinic, whether it's through people that you know, like you say, who have had weight loss surgery, who you might be able to talk to. It's all about that as well.
I did contact a few people through Instagram. That there's like there's a lot of weight loss community people on there, and I reached out to a particular person that had surgery a week before me. So she was always one step in front with like the liquid stage and the soft food stage and things like that. And that was really nice having, I guess, a surgery buddy just to sort of bounce ideas off. Some recipes and things like that also can help. And the dietitian really helped with like different recipes to try, things that you wouldn't even think that could blend together and into a smooth puree actually turned out to be amazing. Yeah.
Yeah, as you say, it's a big journey of growth and development, and as you say, taking it step by step is such great advice. And like you say, sometimes easier said than done, but it's always remembering, you know, even if you accidentally divert to what you were doing before, like you say, comparing yourself, you find yourself comparing yourself with someone else, just go, oh, I'm so used to doing that, I'm going to divert back to this now because I know that doesn't work for me. So it's just a slow back and forth of changing those thought patterns and changing those behaviors.
And it will take time. I'm only 10 months post-op now, and I've probably only, my mind has shifted probably in the last maybe 2 to 3 months. So that's still, you know, a big chunk of my journey where I was, you know, still understanding that everybody is so different and the journeys are all so different, and you've just, you've got to try not to be so hard on yourself. That's my main thing, because
absolutely, we're all way too hard on ourselves. So
we are.
Thank you so much for sharing your story with us, and just to give, you know, some insights, because all of these insights are going to be relevant to various people's journeys, and that's what this is all about, is just sharing information. And the more we do that, the more we bind together as a community, that the more supported we feel, and the more able we can support other people as well. So thank you again for your time today, Vanessa. It's
no worries
with you.
No worries. Thank you very much.